Okay. So I would knock on the door, open the door, shut the door, close the curtain, provide privacy. I would do hand hygiene, introduce myself. Hello, my name is Jacob. I'll be your nurse today. Going to be doing a physical assessment and general assessment on you. Is that okay?
Yeah, it's fine.
Okay. Can I get your name and date of birth?
Zach Bowen, 5'11", 93.
Okay. I've got a couple questions for you. I'll put my gloves on.
Okay.
Do you have any allergies?
No.
Okay. Are you on any medications currently? That includes over-the-counter, herbals, or any supplements?
No.
Okay. Any current medical conditions I should know about?
No.
Okay. And are you up to date on your vaccines?
Yes.
Okay. A couple more questions. What is your highest level of education?
Some college.
Okay. Can you afford your groceries and bills?
Yes.
Okay. Do you have any religious beliefs that would affect the care that I'm going to provide today?
No.
Okay. Just drew a blank. Do you feel safe in your neighborhood and at home?
Yes.
Okay. Circle back to it if I think about it.
Yep.
Okay, that concludes my questions at this time. At this point, I would move into my physical assessment. Is that okay?
That's fine.
Okay, at this point, I'm going to start by getting your vitals.
Okay.
Just put this on your finger. Okay, and check your pulse. Okay, pulse is 65. Your O2 is at 98. While that was going, I counted your respirations. They were at 18. I'm gonna go ahead and get your blood pressure.
Okay.
Blood pressure is 127 over 126 over 80.
Okay.
Okay, go ahead and check your capillary refill. That is perfect at less than two seconds. Okay. At this point, I would move to the head and skull. Actually, I would note that patient's eye contact has provided good eye contact. They have not had any slurred speech so far. No signs of distress, no signs of anxiety, no signs of shortness of breath. They're well groomed, well kept. They're well dressed. Now moving on to the head, I would check for that the size and shape is acceptable for their age. Checking for abrasions and any lumps, cuts, lesions. There are none present. It's free of infestation. Moving down to the ears, I would check for excess wax, any drainage. Any foreign bodies, there's none present. Do you wear hearing aids?
No.
Okay. I would also note that the ears are symmetrical and equal in size. Moving on to the nose, I would note that there's no drainage. The nostrils are equal in size and shape. Moving on to the mouth, the oral mucosa is moist and pink. At this point, I would have the patient look up. Are you able to swallow?
Mm.
Do you care to swallow for me? Okay, perfect. At this point, I would move on down to move down the neck, checking for any lumps or lesions. There's none. I would also note that there is facial hair. I would check to make sure that it is free of infestation. It is well kept, not patchy. It is of normal color. The face is of normal color. It's pink, warm to the touch. It is dry. I would move down to the collarbone, where I would check the skin trigger. It rebounds normally, so the patient is not dehydrated. At this point, I would go ahead and check the chest and abdominal area for any edema, any bruising, discoloration, skin breakdown. There's none present. At this point, I would move on to the upper extremities, checking for any abrasions, cuts, bruising, discoloration, edema. There's none present. At this point, I would check radial pulses. They're equal bilaterally at +2. At this point, I would have the patient put their arms straight out, put them up, put them out to the side, back out front, push up against my hands, push down against my hands, squeeze my 2 fingers. Okay. Are you able to stand on your own?
Yes.
Okay. Do you use a walker or a walker, cane, or any assistive device at home?
No.
Okay. If you don't care, stand up and take a few steps to the door for me. Okay, you can come back. If you don't care, have a seat. At this point, I would move down to the lower extremities, checking for any swelling, edema, skin breakdown, redness, discoloration. There's none present. At this point, I would check the feet and heels, paying close attention to the heels for any skin breakdown, discoloration, or any open wounds. There's none present. I'm going to go ahead and check the pedal pulses. They're equal on both sides. Check the capillary refill. They're good. At this point, I will go ahead and have the patient lean forward. I'll check the back, make sure that there's no skin breakdown, no redness, no discoloration. There's none present. Paying close attention to the sacral area for any redness, skin breakdown, or discoloration. There's none present. At this point, I would make sure that my patient didn't need anything else from me. Do you need anything else?
I'm good.
Okay. If my patient was in a bed, I would have them, or I would make sure that they were safe. I would make sure that their call light was in reach. I would remove my gloves. I would perform hand hygiene, report and record